So with this, we'd like to move on to our first session, which is building in biomarkers and diagnostics. And we'll open it with a panel discussion moderated by Professor Deepak Saini, who's the convener of the Longevity India Initiative. And the panel members include Mr. Mohit Kumar, founder and CEO of Ultrahuman, Dr. Vijay Chandru, who's an adjunct faculty at CBR and also the founder of Strand Life Sciences, Mr. Gaurav Agarwal, founder and CTO of 1MG, and Mr. Kumar Sankaran, CEO and founder of Leucine Rich Bio. Over to you, Deepak.
Cheat, yes. All right, I think we've got a good beginning for the day. And I've got my cheat sheet here, which is about what I should be asking everybody. I think I mentioned when we started, when I meant the first iteration of my talk, where we talked about how do we repurpose what we have learned by taking care of sick people, and how do we use that knowledge to now take care of healthy people. So how do that transition from sick care to health care is going to take place? And largely, I'm going to ask you all about what are your views on that. So a key general question which is posed to all of you, given that all of you have expertise in different sectors and you represent different areas of integrating human body, while Mohit looks into continuously looking at performance of body, you look at traditional diagnostic, gut biome, and genome. We have a wide variety of information coming from human body in various flavors. So general question for all of you is, where is this biomarker and diagnostic market headed for future? Where do you think major changes? Prashant briefly mentioned the hospital of tomorrow is going to look very different. Where do you think it's going to look different? This is an open question to all of you before I come to specifics, so feel free to answer as it.
I'm in the middle, so I'll go first. And there's a famous saying, and I know this is ironic, but there's a famous saying that science progresses one funeral at a time. Not in a longevity conference, but yeah, this is actually true for most domains in science. And I think what's happening now is that there are now two streams of experimentation that are running in the world right now, or two streams of development overall. One is, of course, there is this movement of precision medicine, personalized medicine, deeper research, more practical research. And then there is this other semi-frivolous movement of quantified self, take control over your own body, listen to all the three folks that we saw on the screen, Huberman, Peter Attia, David Sinclair, and Rhonda Patrick, etc., etc. I'm not saying frivolous, but I'm saying that semi-frivolous, right? So some of this is science, some of this is not science as well. But why is this important? Like, is this good or bad? I think in the net sense, at least we believe that this is in the direction of development, in the direction of evolution, because you need both precision as well as interest in this space. And a lot of interest would get generated when people take control over their own health. And why are people taking control over their own health? That's rightly because there is something in the healthcare ecosystem that's actually missing. And whenever that has happened in science, and sorry, I should not be talking science in this group of people, but I think there's always been this, there's a group of people who actually believe in deep science and controlling science to the extent that's possible. And there's always been first principles, observation, thinkers waiting for the apple to drop from the tree. So I think both are going to happen at the same time. And both always work in combination really well. So, yeah.
Yeah, that's a really tough question. What does the future look like? But if you look at the evolution of healthcare in general, it's always been looking for this silver bullet or a panacea. And if you look at all our treatments, etc., they tend to focus on this one treatment that can apply, universally, globally to everyone. I think the other thing that's changing now is that through cheap sensors, the amount of data that's available to you is unprecedented. In fact, Mohit talked about quantified self, and we are all early adopters. Some of us are early adopters of quantified self, only to discover that you see quantities, but you actually don't understand, what they mean, what they do to the body, right? So for me, for instance, I moved away from a lot of these quantified self devices because I used to get anxious. Okay, you see some data, what does this data mean? And the third realization that I had when I was dealing with my own, body and physicality was that a lot of science is actually based on, we call it biological science, but it's still very empirical. The body is this insanely complex system where anything goes wrong and it only has 2 or 3 different ways to show you what went wrong. It will give you a fever, it will give you an inflammation, it will give you something else. And we don't really understand how complex the body is. So over the years, as I've thought about how all of this is going to change, I go back to my days as an engineer, which is, if you look at a computer, it's generating a lot of data, and eventually that data becomes too much for any human being to evaluate, envision, comprehend. And I think we are at that stage where we will start to see, and we are already seeing, we'll start to see just mountains of data getting generated from every biological system. I don't know how many of you saw, but I was reading this fascinating article where this professor is creating a digital twin of your circulatory system. So she basically does 3D scans of your body, creates a complete 3D model of your capillaries, right? Veins, capillaries, arteries, and is essentially able to then use fluid mechanics to predict whether you're going to have any blockage, etc., right? By just modulating the pressure. So this is where we are going. It's insanely complex, but I feel that the amount of data that's going to start getting generated about the human body is going to reach unprecedented levels. And we will start to innovate a lot on how to make sense of that data. And that's fundamentally the part that we at 1MG want to play, because over the years, we serve around maybe 7 to 10 million customers every year. We collect billions of data points, and we are struggling to actually go to science and figure out how to make sense of this data, right? And it's not about diagnostics, and I think this is the biggest sort of disservice that we've done. It's not diagnostics, it's not activity data, it's everything coming together. And the biggest challenge for us is how do we bring things together. So in my view, the future of the hospital is, everything comes together, we start to make more sense of it, and we start to make interventions that are holistic rather than just episodic.
Right, yeah, no, it's interesting that I'm here at a longevity meeting. I'm 71 years old, and of course, I have to believe in genetics. My father was 91 when he won the Seniors Cup at the Bangalore Golf Club with a hole-in-one, so, right? So, longevity does have some aspects of genetics to it. But I think, I'm sorry that Prashant isn't here because, I think it was maybe 10 years ago that Leroy Hood, and really along with Huberman and Sinclair and others, you should have Leroy Hood's picture up. Leroy, we used to run sessions at the AAAS meetings, and he used to talk about P4 medicine, right, which was preventive, participative, precision, personalized, and so forth. So everything that I've heard so far essentially points back to P4, but perhaps the time is now that it scales, and which is why Axel and Prashant and others are getting involved. But it's been around, right? So now I think Leroy sort of proposed this basically because you need all 4 components, right? And I think that's what we've been hearing here as well. And I think there are new tools that you can use. I think when we think about genomics and think particularly methylation and what pointers that can give, and we can talk more about those things. But I think obviously things like participation with continuous monitoring, use of wearables and devices and so on, it has evolved a lot. And systems biology, which in those days was driven by academics like Dennis Noble and and people like Lee Hood, I think is now at a level where you can have much more complexity. And of course, Strand built a virtual liver model, which is today even used at Biocon for predicting toxicity in the liver and so on. Yeah.
Thanks, Vijay. So, Kumar, I have a question for you. Since you work on the biome space, and since biome is now being listed as a culprit for everything which goes wrong with us, people say we are what we eat. I say we eat what we are. And where do you think the biome is going to be useful as in the biomarker or predictive space in the longevity?
You're right. I mean, I often joke that you name a disease and I'll find a correlation with the gut biome. I mean, in your previous question, you were talking about how the biomarker, what's going to be the future of biomarker. Here we are at an interesting space where we can't even define what the gut biome is. Is it an organ? Is it an ecosystem? Is it the second immune system? I mean, everybody has different definitions of it. So we're going into that world with that kind of complexity. And given that, I think there's going to be a lot of data which is going to be strongly correlation that's going to come with respect to the gut microbiome with various diseases. But I think we're still far away from understanding any causality that can be associated. So I know it's been done for a few diseases, and maybe you can start pinpointing at looking at certain microbes or certain metabolites that the microbes produce as a biomarker. But I think for the next half a decade to a decade, it's going to be more correlations than that's coming out from the space.
So it would be fair to say we're still on the discovery stage?
It is partially fair that we're still in the discovery phase.
I'm deliberately pushing you there so that gives business to first scientists like us. So it's like keeps us in business because it's nice to know that we are still in infancy there because there's a lot of ground to be covered.
There's still a lot of ground to be covered, but I think over the last decade and a half, we've covered a lot of ground. I mean, there's a lot of new information that's come out, and that will get translated into the industry very, very shortly.
Yeah, thanks, Kumar. So next question is for you, Vijay. So now with the cost of whole genome sequencing coming down, and actually companies introducing chips which barely cost $100 to know all the SNPs in your genome. So do you think it's soon that we will all know that how our genetics predisposes us to various pathologies or say longevity? And
Sure.
Are we ready for that?
Yeah. No, absolutely. I think this is a very important time that we are in. I think the democratization of genomics, right? I think that's how our friend, Mr. Ambani always says that this is the time for it, and which is why Strand is now part of the Reliance Group. What does that mean? We always thought, and Charles Cantor was my guru on this, he said, when we get to $100 whole genome sequence possibility, that is the trigger, right? That's the tipping point. And today, with taxes and Illumina, and we are probably at about $250, $300 in India, right? In China, they're doing it at 100. It's
Yes.
already there. There are other machines coming. There are other platforms coming. They'll take time to stabilize. But I think we're very close to that tipping point. Now, keeping that in mind, of course, Strand launched into a large genomic health insights program. And we're starting to get data about healthy individuals across the country, right? So this is not published yet, but just to give you some sense of the numbers, and they're pretty robust. I think they may change a little, but as the cohort sizes increase, but roughly about 70% of us seem to get useful pharmacogenomic insights, right, on what medicines work for us, what don't, what sensitivities, what dosages, etc. Right? About 40% of us have insights on health risks, right, which are that we can act on. Right? It could be things like carrier risk, right? So you're carrying a genetic mutation that could, actually affect progeny and, grandchildren and so on. So, for example, I found out that I'm a carrier of spinal muscular atrophy, right? Now, so in this audience, if we sequence all of you at reasonable depth, so we get all the copy numbers and all the details, just on monogenic markers, we will find roughly about 2/5 of the audience, or maybe a third of the audience, let's say, will actually be a carrier of some serious genetic risk, right? Not to scare you, but that is where we are. And of course, the big ones are things like thalassemia, ataxias, cystic fibrosis, and spinal muscular atrophy, right? And of course, the government is working on this through the National Rare Diseases policy and various aspects of that. We'll also get much more data once Genome India project data comes out, which, of course, sitting now at the Center for Brain Research, I'm watching them work on it every day. Of course, there's also the cancer risks, right? And what everyone talks about BRCA, of course, for breast and ovarian cancer, but there are roughly about 100 genes involved in cancer risks. And again, we see maybe 1 to 2% of the population.
So you think the value would be in knowing what you carry the
knowing
risk
and
for?
taking some early
Precautions.
preventive action, maybe essentially going into a tighter monitoring. In the case of carrier risks, planning your family, getting preventive screening, perhaps at a even planning stage of the family, but also prenatal and so forth, right? So there's, now the point is that all of this has a huge bearing on life expectancy, DALI, and so on. So it's important that this is taken up as a national priority.
So interesting. So, I mean, the way I see it is genome is what you're born with. The metabolome is what you need to worry about. So that brings me the shift to the ultrahuman thing.
I'll just end it with one small point, that I think today we are at a point where roughly at 15,000 rupees or less, you can get your whole exome sequenced at a depth of 120x, talk to a genetic counselor. And of course, I believe it has to come down to maybe a third of that to really get
Inroads,
population scale and democratized as we.
Yeah, that's true. That's true. Thank you. Thank you so much. So coming to this metabolomic aspect, which has to talk about, our metabolome is what makes us what we stand today, and it changes on a daily basis. So that means that's where the value of wearables, which Prashant briefly mentioned about, comes to play. What have been your experience? Where do you think the new metabolomes or new biomarkers, continuous tracking of biomarkers would be, something which Ultrahuman will be looking into, and where do you think the tipping point will come and people would say, I know too much. This is what he was, alluding to, that I really do not want to know. Do you think that's kind of an inevitable truth which we'll be staring at with the more variables we get into?
I think there's a decadal shift in terms of how wearables used to be and how they are right now and how they're used right now. Maybe 20 years ago, actually even 10 years ago, wearables were about mostly step counters. Like, oh, how active are you? How many steps are you walking? Are you doing 10,000 steps a day? Um, I think that was the first decade. The second decade was, hey, I have a bunch of data, which is my movement data, my heart rate data, my heart rate variability data, my temperature data, all of that basically. So looks cool. I don't know what to do with it, right? It's fun talking about like, oh, I did this workout and this is my zone distribution, what it does to your body. Yeah, there is some evidence around zone 3 is helpful, zone 5 is helpful for certain percentage of the overall exposure of the week, etc., and all that. And the third decade, which is what we're living right now, has been about, can you actually convert these markers into scores, like gamify them, right? So, like, can you create something called a sleep score by using a bunch of markers around sleep start, sleep end, heart rate drop over time, your minima of heart rate, your temperature patterns during sleep, etc., etc. And and this shift has happened because people wanted a certain kind of behavioral change in their life. Like, oh, I want to understand what affects my sleep, not just my duration of sleep. Yeah, I agree. For most people, sleeping for X number of hours will do the job. But then, does meal timing affect my sleep? And that is depicted by your heart rate drop during your sleep. Sleeping in the right temperature, how does that affect your sleep quality? That those aspects are actually evolving, and now we see people talking more and more about things like, oh look, heart rate was just so 2000s, and now we talk about like heart rate variability, because your vagus nerve and your vagal tone matters, and basically people now want to study things like what affects my heart rate variability, right? Um, Strength training affects my heart rate variability by X percentage versus just not sleeping affects it by Y percentage versus alcohol affects it by 10%, etc. Right? So I think this, while it might look decade by decade and micro, I think because the shift is across the population, I think the impact overall is very much like a flywheel. And what we see is that very quickly we are going to move from almost no data to a lot of data. And which basically means, again, like there'll be a division, which is I'm enjoying a lot of data. I enjoy this absolute control over my body, my life, and my outcomes. And then other set of people who are, by the way, both of them are two different kinds of behaviors, right? There's nothing like one is better than the other. The other kind of behavior is like, oh, this is too much data, right? Let me just live my life the way it should be, right? And I have my own instincts to live. And I think this is all great because I think there is going to be a balance that's going to get stricken here very, very soon, where the systems that we are building at Ultrahuman or other companies in this space are going to make this interpretation and this balance very, very clear and easy.
So you were saying that they may not be what he suggested, a data panic-like situation, where the panic onsets is triggered by data, not the other way around.
So one software engineering anecdote is that, before 2010, the most amount of concurrent users that internet platforms would see would be like 10 million users, 10 to 20 million users, concurrent users, not overall users. And after 2010, 100 million was like a fairly common phenomena globally because of obviously like trading platforms, live streams, etc., etc. And there's something that coincided with it, which is the rise of observability systems like New Relic and Datadog, etc., etc. So if you visit a monitoring room like before 2010, it'll all be chaos, right? You remember those software engineering rooms like, oh, this is a massive sale coming, a spike, surge, people like geeks looking at their numbers and basically looking at, oh, this data block is missing and this will take
Our labs look like this even now.
Yeah. Hence the point that
Right.
basically a lot of mess, but a lot of science.
Yeah.
And then now that is being made available to everyone. Like anyone who does, let's say, 5 years of software engineering can now get into DevOps very, very easily. Like there was a saying in the DevOps industry that 10 years is the entry fee for the DevOps industry, right? Because you need to understand systems deployment, etc., etc. And I think now amateur software engineers, who are actually great, by the way, are getting into DevOps pretty fast. And that's happening in the health industry as well. People who are software engineers, who can basically build great data systems, can get into science because they can add value to science.
Perfect. So I'll actually come back to you. So you've heard all the three, genome, biome, and continuous monitoring. Given a consumer-driven outfit you are, how do you foresee these changes going to impact your business model? How do you see the next set of integration of knowledge which you can champion will come through?
Yeah, no, that's a great question, and I think it's a question that we keep thinking about every day. So, unfortunately, I'm an engineer. I started writing operating systems, and I have a very operating system view of the world, right? So if I think about the early years of 1mg, I kind of view it as our endeavor to build healthcare, rails for healthcare, right? So today, if anyone wants, let's say, blood tests at home seamlessly, 1mg does it. It just happens, you tap into an API, someone goes, collects blood, brings it back to our lab, reports come online. The data is not PDF, it's a JSON with reference ranges, etc. Anyone can use it, anyone can interpret it. Same is true for medicines, delivery at home, all through the world. So once you have this, let's say, an operating system or a Rails ready, where you can start to deliver more healthcare services, what can you build on top of it, right? And suddenly the problem space becomes really, really fascinating, because healthcare is not about medicines and diagnostics, right? It's basically about holistic insights that you can bring on top of it, wherein, let's say, professionals, doctors, or let's say holistic medicine providers, healers, etc., and come in and can provide a 360 view of what's happening. Unfortunately, the 360 view is still not there, right? So 1mg, for instance, does diagnostics, medicines. We don't have activity data. I know Ultrahuman does some diagnostics, but they don't have, let's say, medication data. Genomics, as we know, is still not, mass scale. And I still think, while it's the direction we have to go in, I still think that the utility of the information that comes out still has a way to go. And we are not even, we don't even know what to do with the biome data, right? It's fascinating. And the first time I read about, the gut biome 10 years back, it actually took me back to Ayurveda, because, as much as we poo-poo that whole science, or whatever we call it, right? It's basically where it says that everything's connected to your gut, right? And I didn't value it, right? And that was like an aha moment for me. The big problem at 1mg is that how do we bring all this data together? And even before we get into longevity, I have some very simple problems to solve, right? So we are the chronic capital of the world. We have 250 million people diagnosed or undiagnosed diabetics. Do we know which medication works for whom? We don't, right? Doctors give the same medication to everyone because they don't know either. But at 1mg, we have data for people who've actually been on medications, right? Who've been getting tested. If I bring in activity data also, I can actually now start to do studies that say, hey, for certain genotypes or regional, this medication seems to work better than this medication, right? And this is very basic, right? It actually improves, let's say, your diabetes control, and it moves things forward. And I think that that's really the challenge that we have to figure out, is that how do we bring all this data that exists for a user together? How do we actually point out things that matter and remove the clutter until it makes sense to the user?
And a nice point, actually. So what you're alluding to is that what we really need is some sort of an integrative viewpoint, where we get genomic data, build information based on variables, and then we decide what kind of test an individual should be investing into. So that brings me to another question for you only. So do you see the change in the diagnostic market based on the new information which we're generating from various platforms? Do you think that technologically we're going to come up with new ways to measure things? Not everything can be measured using probably a wearable ring, but I'm thinking he must be thinking of some new device. Could be a patch on, stick on, anything. But do you think that ease of information or technology to a consumer will change the way how you operate as a diagnostic company?
Actually, I think there's a lot of innovation happening in diagnostics, and I'm not even equipped to probably talk about many. I'm sure others here are very, very well equipped. But look, the whole diagnostic industry itself, when we talk about science and devices, is undergoing a massive change. If you think about the basic lipids and glucose, that's transitioning into point-of-care devices. We are talking about microneedles. You look at CGMs. I think India has already leapfrogged. I don't know how many people use CGMs in the US. It's still, I think last year is when they did a non-prescription CGM, right? This year. And we've been, I got a CGM like 5 years back when Abbott first launched Libre Pro in India, right? I think the diagnostics industry itself is undergoing a massive shift. It needs a lot of innovation, and I'm really glad that innovation is coming. And I think a lot of it is simply about India evolving as a market, where we can afford, we have large numbers, we can pay for some of these things, and we can do. Thankfully, regulatory here is much more benign than, let's say, in the US, and we can pay for a lot more things and make them accessible to people.
Right. Thank you so much. So Vijay has a point.
Yeah, I think, just to add to the points just made, I think the diagnostics industry really went through an extraordinary transition during the pandemic. And it's important to keep that in mind, because public health was triggered by the Spanish flu. And I think the COVID pandemic really did something that has triggered diagnostics in a big way. If I might just take half a minute, I do.
The clock.
Right, I could see that. I just didn't want to leave you with the feeling that it's only germline analysis in genomics. If you look at the hallmarks of longevity, there are 3 areas in which genomics has a big play. One is in telomere attrition, genomic instability,
Yes.
and epigenetic alterations, right? And clearly with telomeres, we have found at Strand in studies with Harvard School of Public Health that even if you can extract DNA from dried blood spots, which makes the logistics extremely simple, you can actually read the telomere lengths pretty accurately, within 10%. Second, on genomic instability, because of studies with cancer and HRD, HRR testing and so forth, we have learned how to look at genomic instability at a very granular level. And I believe that that's going to lead to very interesting new insights in longevity as well. And finally, on epigenetic alterations, as I said, DNA methylation, there are now probably more than 12 clocks, epigenetic clocks that have been proposed. If you look at the serious ones, I think you still need about 1,000 points to be measured, which is kind of complex.
So at
and
that
right.
note, I think
Right.
it's interesting you mentioned all these things, but the problem for all these tools is they have come from understanding from sick people. The understanding of healthy people is still what makes all these clocks and everything largely confusing, and it gives us a lot of ground for us to cover. So I think we got to stop here as a panel, but because we need to open to questions from the audience. The purpose was this meeting is to let audience ask everybody what they feel. So the floor is now open, and anybody who has a question, please feel free to ask.
Great discussion. So my question is, a lot of science is still evolving, because especially combining data-driven science with putting conventional scientific aspects together and coming up with new hypotheses and so on. So as science evolves, innovations need to be rescoped and redefined. So how do you see it? Do you see that as a major challenge? So any innovation that is there, does it have a lifetime of some kind?
I think that's not going to be a challenge as such, or that the reality is that I think we are going to see much more participation from people. not as much a challenge because of all that is happening on the internet. A dear friend of mine actually told me some time back that I was asking him like, oh, this is all this biohacking stuff interesting, and like, like why do people get into biohacking, right? And there is precision science and precision medicine happening and all that. Why are people irresponsible with their health? And he was like, no, biohacking is dopamine. I think sitting somewhere here, his name is Shiva. He was telling me that, like, he's also a panelist here sometime in the day. He was mentioning that, yeah, it's all dopamine, right? I mean, it's all great for the world, because if more people are interested, then there are more people interested in science. More people interested in science, more science will get funding. More science will get funding, then obviously you'll have more deep research. And for this flywheel to start, you need interest. You can't only have academicians in a room and talking about the science and all the cool stuff and keeping it to themselves, right? So share the knowledge.
No, I think just to Nagasuma's question, I think interdisciplinarity, multidisciplinarity in teams that are going to look at this confluence is very, very critical. And I think, probably that that's why it's called the tech-bio convergence, right? And you're not going to be able to do this with just tech. Right? You're going to have to bring multidisciplinary teams together. You have to invest in R&D. If you don't invest in R&D, you can't keep up with the science. Right?
Just a quick point to, I think what Suma was talking about, is that both sections, the tech as well as the deep academician, need to be open to new ideas which will emerge from that analysis. So we are entering into with some hypothesis, but be ready that that hypothesis will flip over. If it's not dopamine and it's something else, be ready for that. Are we ready to leapfrog a platform technology that you might have built with a certain hypothesis to quickly pivot that to something else? If I'm not mistaken, I think that's where she's coming from. And we have to both, or all the parties involved, have to be cognizant that you should be able to quickly pivot from one hypothesis to another based on what emerges from the analysis.
Okay, I have a quick question. So whatever we are measuring here, whether it's a wellness marker, our sugar levels, or we are measuring blood markers of health, we are actually looking at human traits, which are a mix of epigenetic factors and genetic factors. And I think as a person who comes from I'm a scientist turned entrepreneur, I see there is a big gap in industry when we try to combine those two aspects, the genetic and the epigenetic factors that we are measuring through various devices. How, as an industry specialist, you see this area coming to whenever we are measuring a biological trait, we have to keep both things in balance. How do, as industry experts, we see that coming forward in future?
Yeah, look, that's a tough question, and I can maybe give you an example that in one of the genetic screens that you do, you can actually get a risk score for your lipids, your cardiac profile being, let's say, compromised, right? Compromised in different ways, your lipids being predisposed to lipid, etc. So ideally, when you actually measure someone's lipids, right, you should also be aware of at least, are you in this deranged range or not? Because I think the risk factor also changes whether you have a predisposition or not. I think part of the challenge we run into is that a lot of new technology that comes is for one or the other reason, financially or technologically not accessible to a large swath of people. And in which case, I think a lot of healthcare biology insights today are islandic, right? They're dependent on bits and pieces of information. But I do think that I do believe that what's definitely happening, as Vijay already mentioned, with the $100, let's say, a sequencer coming in, sequencing coming in, etc., is that a lot of data is going to start to come in, building much more holistic profiles of users. It's not going to be easy. I don't think it's going to happen tomorrow. It's going to happen through fits and starts. maybe we will take a stab and fail, but someone else will, pick up that flame and go forward. It's going to happen, but I think it's a tough problem, and it's probably not going to happen today.
I think actually where we're going to see genetics and epigenetics come together in a very integrated way is in early detection of cancer. I think that will be the commercial driver. And once we see that happening, you will then be able to have the tools to do these integrations much better. And I'm happy to say that Strand is quite far along in this, and you should be hearing some things pretty soon.
I think you're right. The context of heritability of a trait is very important to keep in mind. Cancer being highly heritable, whereas traits like aging are controlled by epigenetics. So we need to have the context of heritability there, I suppose.
Let's have a question from other audience.
Yeah. So hi, Ashwath. Yeah. It's more towards Vijay actually. So I kind of want to delve a little bit more into the genomics where you said you're looking into telomere attrition, stability, and epigenetic alteration. So I mean, a lot of this is actually seen from the context of cancer, right? I mean, and cancer in a certain sense is a tipping point because it's quiet and then it happens in a certain sense.
So genomic disease.
Yeah. So do you see the aspects of these how do I put it, mutations, SNPs, be it monogenic, polygenic, or however it is? Do you see an effect even before cancer hits? I mean, is there anything else in the biomarker that you've seen where you're seeing some sort of a pattern, or is it only after you see that tipping point where cancer is hit and then you see, oh, here's what we correlated with?
You got to keep questions short and answers short.
Right. No, I think we can take this offline. There are methylation markers that actually show up, even in benign cases before the malignancy sets in, and there are complexities. We can talk about it.
Here will be available for discussions, hopefully. I'm taking liberty on behalf of all of us. We'll be around here, so you can actually ask questions if you have more questions.
Just a quick comment and a question. So, you mentioned about the we are progressing towards half of our population being diabetic. So the glycemic clock, I guess, is very, very important, and inflammaging is very, very important. And my question to you is that where do you see the wearables and having an intervention through wearables like your hormones, like if you could test through your sweat, and if you see the diurnal variation in hormones and you can have an intervention in that, so in how many years do you see that, and will that be possible?
The question, I'll rephrase the question. When is Ultrahuman coming out with a sweat-based sensor, right?
I'll keep the answer short. There are two interesting approaches in this direction. One is a sweat-based approach, and there's an NMR-based approach that's emerging, where there are companies trying to miniaturize the spectroscopic part, magnetic resonance spectroscopic part, into the form of a wearable. I think I'm personally excited more about the second approach, given the limitations around sweat and what's not possible with sweat, etc. But yeah, probably like within 10 years from now, not before 10 years, I think. Still very, very far.
And this is the longevity meeting.
Sweat-based ring which just came out this year. So from Vegas lab in the US, a sweat-based ring has they've just published this.
And
If I can
since we
take
are-
one last question.
Make it very short.
Sure.
Time starts now.
Sure. My name is Shifali. I represent Serotonin Labs. We actually have a platform that brings multimodal inputs for monitoring a person's wellness. My question is to Mr. Sankaran. How soon do you see microbiome diagnostic getting extremely commercialized? I mean, we've heard about genomics being, and they've set a very ambitious target of bringing it down to 5,000 rupees. How soon and what kind of evolution would you expect in that space for the gut microbiome?
Well, that's a very easy question to answer. Very, very soon. Genomics is leading the way in bringing the price down, and we are the byproduct of that. So sequencing microbial genomes instead of human genomes, and because of that, the prices will come down. So when we launched the test in 2017, it was 36,000 rupees, and over the years we've got it down to 10, and should hit that mark very, very soon.
Thank you.
I think we need to thank all the panelists here for interesting input and suggestions. And on the closing remarks, I hope there will be a gut microbiome sensor also very soon.
Can we have a quick picture, please?
And that will be really nice to see.
Okay, while the picture is being taken, I would like to thank all of the panelists, and I would like